first, let's welcome Dr. Nicholas Bodenheimer of Novant Health OB/GYN. Welcome, Dr. Bodenheimer. It's great to have you on the show again. For those viewers who maybe haven't met you yet, can you tell us a little bit about your education and your background?
Sure. My name's Nick Bodenheimer. I'm originally from High Point, North Carolina.
Okay.
I went to undergrad at Gardner-Webb University. Then I went to get my master's in anatomy at Creighton University in Omaha, Nebraska. And then I went to medical school at the Virginia College of Osteopathic Medicine in Blacksburg, Virginia.
Nice, you made your rounds. You
I
went
did,
to different spots.
all around the United States, yeah. And then I did residency at New Hanover Medical Center in Wilmington, and I've been with Novant for 3 years now.
Nice, time is flying. It's hard
Absolutely.
to believe that it's been 3 years. So you're with Novant Health OB/GYN. Tell me a little bit about that group and the locations. I know you have several now.
Sure, absolutely. So we have 5 board certified obstetricians and gynecologists. We have 1 nurse practitioner, and we have 1 board certified part-time gynecologist. We have offices in Bolivia, Southport, Leland, Carolina Shores,
Yep.
so we're definitely staying busy.
Very good, yeah. Covering all those offices and your own medical staff at Novant Health Brunswick Medical Center, correct?
Right.
Very good, very good. Well, I think there's a million topics we could talk about, but today we really wanted to focus on minimally invasive and robotic surgeries. I think that's such a popular topic out there in the community now, folks wanting to know what's available and what that even means. So tell us a little bit about what types of gynecologic surgeries are available with a minimally invasive or a robotic option.
Sure. So minimally invasive surgery is kind of an umbrella term. Under that, you have what we refer to as straight stick laparoscopy as well as robotic assisted laparoscopy. Mm-hmm. When we're looking at these procedures, usually we look at procedures such as hysterectomy, correction of pelvic floor prolapse, removal of just uterine fibroids, as well as resection of endometriosis.
Okay, very good. So there are kind of 4 main types, it sounds like,
Absolutely.
that would fall into these categories. Very good. So in general, and I know it's hard to talk about these 4 different procedures in a general way, so we can certainly call them each out as well. What would you say is the primary benefit of being able to have these done on a minimally invasive basis?
Sure. So on an anecdotal level, there's benefit for the physician as well as benefit for the patient. In regards to the physician, and we're looking at robotic assisted minimally invasive surgery, it's another tool in our toolbox to use. With the robotic surgery, we're able to sit at a high definition console and see a 3D view of the pelvis. We're able to gain magnification that we wouldn't have with traditional or straight stick laparoscopy. And we also get a high degree of dexterity with those instruments. With straight stick laparoscopy, which is what most viewers may be familiar with, a doctor standing beside the patient and using instruments this long doing surgery, we're able to have instruments that are able to mimic our hand motions. So whereas straight stick laparoscopy, it's pretty much up, down, side to side, you may get a little turn. With the robotic instruments, we're able to get different degrees of bend with those instruments.
Wow. Wow.
So it's very nice for the physician. In regards to the patient, there's patient benefits too. What our aim is shorter hospital stays, less blood loss, shorter operative times, minimal scarring. And those are all benefits that the patient could expect.
So shorter recovery, less scarring. Those certainly are very important to patients. That's great. So all of the procedures you mentioned, the 4 that we talked about, can you do them all with the DaVinci? It's the DaVinci robot, correct? Or
it depends. Every patient's different, so it's really discussion that the patient would have with their physician whether or not they would be a candidate for a minimally invasive surgery, or even would they be a candidate for robotic assisted minimally invasive surgery. When I see a patient and we start to discuss their case, we go through all the different options. And the first question is, what's their diagnosis, and would be doing nothing, would that be a possibility? Sometimes hands off is the best approach.
Right.
Then we discuss medical options for their case. Then finally we discuss if there's any surgical options. When we're discussing surgical options, you want to look at the patient's anatomy to see whether or not they would be a candidate for minimally invasive surgery. Look at their other comorbidities, their other diseases, to see would they be a good surgical candidate. Also look at their surgical history and what other surgeries. These would all be factors that would come into play when you're trying to determine whether or not a patient would be a good surgical candidate for.
Right. Well, it sounds like it's a really comprehensive review
Absolutely.
of what's going to be best for that person.
Absolutely.
And I think as a patient, that's what we want to hear.
Without a doubt.
Yeah, and more patients kind of want control in the decision making as well. We want to have a say, and it sounds like that's kind of how you approach it.
And that's the
what's
most
going to work
important.
best.
Absolutely, that's the most important thing is when we're addressing a patient's health care, we want to be a team.
Very good, very good. And you kind of referenced this, but it sounds like there are times when minimally invasive or DaVinci Robot may not be the right option for the patient. And can you talk a bit about that?
Absolutely. So when a patient comes in, when we're working up whatever disease, we start to look at those things that I mentioned before. We start to look and see, would medicine help treat this condition? Maybe we don't need to jump to surgery and take on the risk of surgery. We look at their medical history, look at their surgical history, we look at their anatomy now. All those would be different factors that we would consider before telling a patient that they would be a candidate for robotic-assisted minimally invasive surgery.
Yeah, that makes sense. Well, I think people want to hear, we're going to try all the options before surgery, but we're ready for that if we need to be. Thank you so much for taking the time to join us today. As we wrap up, is there anything else you'd like to share about the robotic surgeries or about your clinic?
If anyone's interested in discussing further robotic-assisted minimally invasive surgery, myself as well as Dr. Thompson perform robotic-assisted minimally invasive surgery, so they can make an appointment to discuss their options with us.
Wonderful.
Our number is 910-721-4050 at the main clinic in Bolivia. And we'll be happy to sit down with anyone and talk to them about their options.
Great, very good. It sounds like, so you and Dr. Thompson are the two
gynecologists that perform robotic.
And then you have a full clinic doing OB and other GYN services as well.
Absolutely, yeah. We pride ourselves on providing comprehensive health care for women from adolescence all the way to postmenopausal period.
Great. Well, thank you for taking time to be with us today, and thanks for the services you're providing in the community. We appreciate it.
Glad to be here.